Welcome to the UT Healthies Texas Virtual Education Series. Today's presentation topic is migraines, featuring Dr. Allison Hennigan, board-certified neurologist at UT Healthies Texas Neurological Institute.
And I am here to talk to you about migraine and what you need to know. So what I'm going to tell you today, migraine. What do you need to know? What is a migraine? Why is it happening to me? What can I do about it? I don't like prescription medications. Are there options for me? Why does it change? Why is my migraine different than it was before? When do I need to see a doctor, and when do I need to go to the emergency room? So, what is a migraine? Too long didn't read. I've got to lay down in a cold, dark room, and don't you dare talk to me. But really, the criteria for migraine are that it is 2 out of 4 criteria. It is either throbbing, severe, worse with activity, or unilateral. So it's one of those, or it's 2 of those 4 things, plus nausea or vomiting or sensitivity to light and sound. So if you have those characteristics, then you have migraine. So a migraine does not have to be severe, but oftentimes it is. So why me? Really, migraine is a genetic condition. Everybody has a threshold above which they get headaches. People with migraine genetics have a lower threshold than everyone else, and more things pushing them over the edge. Your mission, should you choose to accept it, is to figure out what pushes you over the edge and avoid the things you can, because there are some things you can't do anything about, like the weather. Oftentimes, weather is a trigger for many people. Hormones, there's hormone changes throughout the lifespan. Trauma, hitting your head, getting a concussion. Weather, foods, smells, stress. The list goes on, and everybody's list is a little bit different. You are never going to be able to control all of your triggers, but that's one component of appropriate treatment of migraine. So what can I do about it? Well, the first thing starts with a lifestyle. The 3 most common triggers are not enough water, too much caffeine, not enough sleep. If you can control these 3 things, getting 64 ounces of water, protecting your sleep, aiming for 7 to 8 hours of sleep, 9 to 10 for kids. Okay, so if you're between the ages of 12 and 18 to 25, 9 to 10 hours are needed, not just 7 to 8. Exercise can be helpful for prevention of headaches. Avoid excessive caffeine and avoid artificial sweeteners. Okay, so those are some of the bigger triggers that people find the easiest to change. Now, if you drink a pot of coffee a day or a 6-pack of Dr. Pepper, don't stop all of a sudden. Wean yourself off until you're on 1 serving of coffee, which is 6 to 8 ounces, not a Mucho Grande latte at Starbucks. And wean yourself until you're on 1 soda. Okay, and again, avoid those artificial sweeteners. Recognizing your triggers. This is an invitation. Your body is offering you an invitation to learn how to be in relationship, okay? So you need to take care of your body, and your body is offering you advice on how to do that, and the advice just comes in the form of a migraine. So you don't like prescription medications, you don't want prescriptions. Well, the first place to start, again, is the lifestyle that I mentioned previously. But there are vitamins. So there are 5 vitamins that have been shown in randomized controlled trials to be helpful for prevention of headaches. 4 of these I recommend. 1, I'm a little bit hesitant to do so. Riboflavin, 200 milligrams twice a day. Magnesium, 400 milligrams daily. Now, riboflavin can make your pee look funny, and magnesium can give you abdominal cramping and diarrhea, so be careful with those. Coenzyme Q10, 200 milligrams daily. This can interfere with some blood thinners. And then Feverfew, 50 to 100 milligrams, which is a over-the-counter anti-inflammatory type of a medication. So again, all of these vitamins, you have to be careful with the medication that you're taking and make sure that they don't interact or interfere. The one that's a little bit more challenging is butterbur root. It's not always processed correctly, and so talk to your physician if you want to try butterbur root as a preventative. Many people have pain in their neck as well as pain in their head associated with migraines. And so you can look up neck exercises. These are stretches to try and help your neck muscles have better habits. So you have to teach your neck muscles better habits to be able to prevent those headaches from happening. And then manage your stress, right? So we know that increased stress triggers migraines, and we also know that relaxation techniques, breathing techniques, meditation, those types of things, biofeedback, can be helpful as far as both preventing headaches and managing them. With relaxation techniques, it can oftentimes make as-needed medications more effective, okay? So relaxation techniques are something else that you can use, okay? So we've done a lot of talking about prevention, but really there are 3 phases of headache treatment. There's what do I take if I have a headache? That's actually the second phase of treatment. The first phase of treatment is what we've just been talking about, prevention. If you take anything too frequently, it can lead to a rebound headache. So you have to be really careful with how often you take over-the-counter medicines or prescription medications as needed. Just because a prescription says you can take it every 4 hours doesn't mean that that's good for the migraine long term. It might get rid of the pain short term, but long term you're going to need to think about other things as well. So phase 1, prevention. Phase 2 is getting rid of it, okay? Prescription medications we can use for both of these different phases. So anti-seizure medicines are some of the medicines that we use to prevent the pain. So these are medicines like topiramate and Depakote. Antidepressants like venlafaxine and amitriptyline. Blood pressure medicines like propranolol, metoprolol, and lisinopril. And then there's a new type of agent called a CGRP inhibitor that everybody in migraine is really excited about because it attaches to a chemical that's specifically migraine related, whereas the other medicines that I mentioned are doing double duty. So that's what we want to do as far as prevention of headaches. And you can work with your doctor to figure out what risk factors you have, what other conditions you have, what other symptoms you have to figure out what medicine is right for you. It's not a one-size-fits-all type of a situation. It depends on what side effects you want to avoid and what other situations you're looking to help. So phase 2, how do I get rid of a headache? Well, there are several different medications here too, and some of them are more migraine specific. So usually what I do is I give people 3 different tools. The first tool is a triptan. Now, triptans are vasoconstrictive agents. They can increase your risk for heart attack and stroke, so not everyone is a candidate for them. But they can be very effective. There's some trial and error, though. So one of the sumatriptan is one of the abortive agents, one of the get-rid-of-it medications. But some people have bad side effects with sumatriptan. Just because you have bad side effects with sumatriptan doesn't mean that every medicine in that class, like rizatriptan or frovatriptan, are going to do the same thing. And so there's some trial and error to find the right medicine in this particular category for you. Phase 2, the second phase 2 medication, I call it weapon number 2, is the migraine cocktail. There's no alcohol involved. It's 2 Tylenol, 2 naproxen sodium, an anti-nausea medicine, usually either Reglan or Phenergan, depending on how sedating those medicines make you, and Claritin, so over-the-counter loratadine. So most of those are over-the-counter. The anti-nausea medicine is a prescription. Sometimes if there's a lot of muscle tension, I'll add a muscle relaxant to that. But that's the cocktail. And then the weapon number 3 is, again, CGRP inhibitors. And so CGRP inhibitors can be used to both prevent and get rid of the headaches. Now, the CGRP inhibitors that prevent are mostly injections, although there is a pill. And the CGRP inhibitors to get rid of the headaches are pills. So CGRP inhibitors can be very helpful as far as prevention, or as far as getting rid of the headache. So, a question that I get quite a bit is, why is it changing? My headaches were minor, and then all of a sudden, when I got my period, they started to get much worse. All of a sudden, when I had my babies, they started to get worse. All of a sudden, when I went through menopause, they started to get worse. There's variation of headache throughout and migraine throughout the lifespan. So just because it's not the way it was before doesn't mean it's not still migraine. That being, you respond to triggers differently over time. You respond to red wine differently when you're 20 than you do when you're 40. There also could be something wrong. And so it's something to be aware of. And again, this is your body's invitation to learn how you need to take care of it. Okay. So if you have a headache that's different, that's associated with things like fever or weight loss, with things like it's just not going away. So when you need to see a doctor is when the pattern changes, so that you can discuss how the pattern is changing and whether or not it's concerning, right? When the headaches bother you, okay, if they're limiting your ability to function, then that's a good time to see a doctor. You don't necessarily need to go to the emergency room. It doesn't need to be an intense headache. There's a phrase in headache medicine that's called presenteeism. When you have a headache that's bad enough to impact your ability to work, but you're still at work, you're just working at lower capacity because you have pain. And so that's something that we don't always think about, but that definitely impacts a person's quality of life. So the other time to see a doctor is when you want to take your life back. Pills or no pills. Talk to a doctor about something that can help you get better control of your life. You don't have to miss all the family events. You don't have to go to work in constant pain. You don't have to spend every weekend in bed to recover so that you can go to work. There are tools that we have that can help. When should you go to the emergency room? If you have your first and worst headache, if you have never had headaches before and all of a sudden, bam, you're on your knees, 10 out of 10, blinding pain, it feels awful. That's an indication that you need to go to the emergency room. If it's lasting way longer than usual, if you're used to a headache that, say, lasts a day or two, and now it's lasting 3, 4, 5 days, and it's very intense and it won't let up, that's a time to go to the emergency room. If you can't keep anything down, if you're too nauseated to keep pills down, if you're too nauseated and that's not typical for you, that's when you go to the emergency room. If you have associated stroke symptoms, so stroke symptoms are be fast, okay? So balance, if your balance is off, if you've had a change in your vision or your eyes don't look right, double vision, things like that. If your face is drooping on one side, if you raise your arms up and one of them drops, if your speech is slurred or you can't speak appropriately, and then time. So with stroke-like symptoms, the sooner you get to the emergency room, the better off you're going to be. Okay, so those are symptoms associated with the headache that mean that you need to go to the emergency room. And then phase 3. So for typical migraines, phase 1 is prevention, phase 2 is get rid of it. Some people progress to phase 3, which is called status migrainosus, which is a headache that lasts for 2 or 3 days and they can't get rid of it, okay? If that happens, oftentimes we have to use injectable medications. So either IV medications, sometimes we'll use injections in the head or injections up the nose. There are different tools that we can use, sometimes pills, but sometimes you have to go to the emergency room to really break that headache cycle. So the bottom line, it is not normal to have to fight a headache to get through your day. Ask for help. That's what we're here for. We're here to help you feel better. You're not alone. In 1 million people in East Texas, 250,000 of them have headaches. You are not alone. And just because you don't think your headaches are as bad as your Aunt Susie's doesn't mean that you don't need help. Your pain is real, even if all the tests are normal. Okay? There are options out there. You just have to find the ones that work best for you. Okay. So we've gotten some questions about migraine that I thought I would go ahead and address today. So 1, how can I pinpoint what triggers my migraines? So I mentioned it a little bit. There are different resources to do this. There's apps like Migraine Buddy. There's a book called 1-2-3 Heal Your Headache that talks about dietary triggers. But really, it's just kind of paying attention. So I usually advise my patients to keep a headache journal. Okay, so you can get a year on one page and just think about your headaches in terms of how significant they are in terms of a stoplight. So green is I have a headache and it's not going to stop me. Yellow is I have a headache and I've got to be cautious. I might need to change my plans. And red is I'm down for the count. I can't function. So think of it in terms of that and start keeping track of your headaches, how frequently they're happening. If you have headaches more than 4 times a month, you need to be doing something different for prevention. You don't just need to be chasing after it with medication. But as far as triggers go, paying attention to, oh, I had Chinese food for the 3rd time this week and I had a headache. Or, I was up late with my family last night and I have a headache today. So paying attention to when you have a headache and thinking back to what could have happened, whether it be weather or sleep or food, okay? And different people have different types of triggers. So it's just a matter of paying attention to your body. Second question is, will a migraine lead to a stroke? So that's a great question. There are definitely some types of migraines that have a slightly increased risk of stroke associated with them. And there are definitely migraines that have stroke symptoms that aren't strokes. And so both of these things can happen. So it's something to be cautious about. That's one of the reasons that you need to go, if you have stroke-like symptoms and you've never had them before with a headache, it's one of the reasons to go to the emergency room to get checked out. So there is a very slightly increased risk of having a stroke associated with migraine with aura. So aura is usually either visual or sensation related, but not always. And the risk is very tiny. It's not something that we advise people with migraine with aura to be on aspirin a day or anything like that. It's just something to be aware of. Now, if people with migraine get an MRI, oftentimes we'll see what we call migraine spots. So teeny tiny little scars on the brain that we see in people who have migraine. These are not strokes, they're just small scars that are an indication of the vascular nature of a component of migraine. And the last one, can children get migraines? Absolutely. Children definitely get migraines. For adults, migraines last about 4 hours or more. For children, they can last 2 hours and usually they're milder pain. Not always, though. Oftentimes, if you get migraines as adults, you've had smaller headaches as a child that have just progressed as time has gone on. So again, children need more sleep. Children have different triggers. There's something called abdominal migraines, which has more nausea and abdominal pain associated with it than necessarily headache. So kids can get migraines. They look a little bit different than they do in the adult population, though. Thank you very much for joining us, and I hope that you all can get relief of your pain.
We hope you enjoyed the presentation today. If you're having migraines, please see your primary care physician. If you don't have a primary care physician, call 903-596-DOCS or visit uthealthiestexasdoctors.com. Our next virtual seminar will be announced soon. Follow us on Facebook to stay up to date on upcoming events and seminars. Thank you for joining.